Welcome to a fact-filled video designed to help you understand what autonomous medical coding really is, how it works, and the benefits it brings to healthcare. This is a large and complex topic, but we'll focus on key points to give you a solid foundation. As with any new paradigm, autonomous medical coding comes with its own set of truths, misconceptions, and exaggerated claims about what it can actually achieve. Let's start by defining autonomous coding, without using a competitor's definition. We will also define computer-assisted coding, or CAC, by referencing AHIMA's official definition. We define autonomous coding as a technology that uses artificial intelligence, or AI, to automatically process patient data and generate medical codes. This process eliminates the need for human interaction with the patient's chart or documentation. Alternatively, computer-assisted coding, commonly known as CAC, is the process of using software to translate clinical documentation into medical codes for billing and coding purposes. CAC takes in clinical documentation, and then the software uses natural language processing to analyze the document and identify key terms and phrases. The software then generates medical codes for review and validation by a trained human coder. Now let's look at some key points about what is true and false about autonomous coding. True. Autonomous coding was first introduced in 2005 by artificial medical intelligence as a byproduct and not an evolution of computer-assisted coding at Robert Wood Johnson University Hospital in New Brunswick, New Jersey. Some newer companies market their solutions as an extension of CAC, which is likely due to their omission of foundational CAC workflows. CAC's main goal is to suggest codes and provide a comprehensive toolset for coders, but it does not automate the entire process. Myth. Autonomous coding is plug and play. This is false. Autonomous coding is not a plug and play solution. It requires a thorough implementation phase to fine-tune the AI or coding engine to achieve optimal results. Human oversight is crucial during this phase. Myth. Autonomous coding can automate everything. This is also false. While vendors may support this claim, it's not entirely accurate. Facilities often believe this too, but let's clarify why it's a misconception. As we explained in some of our previous videos, which we'll link here and below, there are a number of variables that determine whether or not a chart can be automated, some of which include consistency and clarity of clinical documentation, as well as assimilation of customer-specific guidelines, just to name a few. Fact: not all medical records can be autonomously coded. This is true. There are several reasons for this, many of which relate to documentation consistency. Success begins with high-quality documentation by healthcare practitioners. This is essential for autonomous coding to work across specialties, including complex cases like inpatient observations. Document consistency isn't just about standardized headers and medical records. It's also about how accurately practitioners record diagnoses and procedures, ensuring clarity and precision. Fact: autonomous coding has revenue cycle limitations. This is true. Vendors that offer coding only as a back-end service without feedback for clinical documentation improvement or workflow support limit both quality and control. For effective revenue cycle management, healthcare facilities must maintain control over their health information management systems to avoid risks like fraud, abuse, or OIG audits. Myth: autonomous coding is limited to certain specialties. False. The key to expanding autonomous coding capabilities lies in documentation consistency and high-quality input from healthcare providers, whether dictated or written. Myth: metrics can predict autonomous coding success out of the gate. This is false. Claims of high percentages of autonomous coding success from the start are misleading. These numbers are often based on best-case scenarios and should be seen as a red flag. Everything depends on the quality of the documentation. Fact: autonomous coding is characterized as 100% accurate. This is true. An autonomous coding queue should be able to withstand expert audits and follow all necessary guidelines, including those from CMS, Coding Clinic, and payer paradigms. It is not designed to replicate the output of manual coders, but to exceed traditional benchmarks. Fact: offshore coder output is insufficient for tuning autonomous coding. This is true. Offshore coders often fall within the acceptable 94 to 95% accuracy norm, but this standard should not apply to autonomous coding. AMI's autonomous coding tools are designed to bypass potential pitfalls like incorrect diagnoses, location or laterality errors, or illegible documentation, all of which should be flagged for review by a CDI expert if necessary. Myth: autonomous coding guidelines can be transferred across sites without effort. False. It's critical to understand that while some standards like CMS guidelines can be transferred, each facility has unique coding policies. Autonomous coding requires a learning phase to adapt to these site-specific rules. Setting up proper inbound and outbound HL7 interfaces, as well as receiving documentation in various formats, is key. Fact: implementation is key to autonomous coding success. This is true. The implementation process includes setting up interfaces, managing expectations, and ensuring that all stakeholders are educated about the technology. Successful implementation can reduce coding staff and outsource labor. Fact: autonomous coding can handle all medical record types and specialties. True. The consistent output of high-quality, well-documented medical records is crucial to the success of autonomous coding across all specialties. We hope this guide helps you better understand the paradigm of autonomous medical coding, especially as designed, implemented, and continually improved by AMI since 2005. Whether you choose AMI or another vendor, understanding the key aspects of autonomous coding will help you make an informed decision. Thanks for watching. Make sure to like and subscribe.